So Ziqitza is an emergency ambulance service set up by 5 friends. We started with one ambulance 11 years back with strategic tie-ups with London Ambulance Servicing, New York Presbyterian EMS, who provided the protocols and processes and the domain knowledge of how to operate ambulance service to 5 individuals who didn't have a clue about healthcare till they quit their jobs to start. This is a graphic representation of the impact we have had. We now have 5,000 plus full-time employees, 1,200 ambulances in 17 states across India, and have served 3.25 million plus patients. And we have transported over 600,000 pregnant mothers for delivery and have delivered over 8,000 babies on board the ambulances. So it's actually becoming routine delivering 10 plus babies inside our ambulances because the women call the ambulance late. Interestingly, earlier this year, with Acumen Fund and Grameen Foundation, we did a study on an impact measurement of which segment of the population receives our service. And Grameen Foundation actually used PPI as the basis where they used 10 data points to analyze or get the information as to which segment they belong. And interestingly, we used a call center approach rather than a home-based approach where we call our people whom we have moved or the families to get the information. After having done that study, I mean, it was very significant in the sense that in Orissa we found out that in rural Odisha in India, that's East India, where in rural Odisha the BPL percentage is higher, we recognized that actually our service was serving less percentage than the population percentage of BPL population in that region. So we have actually post that study now tried to understand why it is so, and we realized that the tribal population in that region assume that these ambulances are not for them and didn't call or don't call the ambulances when they need, simply assuming that they do not have access to it. So now we are undertaking campaigns so that the population, the BPL population and the tribal population gets.
Can you just explain what BPL is?
BPL is below poverty line, which in India is under $2. Those people earning less than $2 a day. Now, after having done the study, we just recognized that there are easier ways to do these impact studies. So we were never tracking BPL as a metric, but once we got to recognize the impact of this study and its and the impact we are having on the ground, we now went back to another state, Bihar, and simply adapted our process. While transporting the patients, we asked them which ration. In India we have the food distribution program where each family has what is called as a ration card, food ration card, and there's a color for BPL and there's for another color for APL. So name or data point, so it was insightful because we were missing out on that data. With the Grameen Foundation, we went through the a laborious process which we adapted now so that we now have the data point. And we believe that impact measurement is very, very important, because otherwise we might have the infrastructure in place, we might have the processes in place, and simply people who need the service may be missing out.